Hey everyone, in this video I'm going to talk about emotional intelligence and what that means for a registered nurse. If you want to learn more about nursing and the nursing profession in general, please consider subscribing down below. I'm going to be uploading a video every Wednesday and Sunday, and you don't want to miss out. So what is emotional intelligence, and why do I think it's so important for a nurse to be aware of this term? Well, emotional intelligence is the ability for you to regulate your emotions during stressful situations or be able to empathize with a patient and the family situation. And the reason why I think it's so important, especially working in a critical care situation, is because we often, as nurses, as nursing professionals, we often become kind of screened for all these different diseases, and we're able to treat these people, but we fail to recognize the difficult situation that that family or that patient is in because we're so focused on providing the interventions necessary. We tend to not provide enough empathy for the family. We tend to break down, or we tend to be overburdened by the tasks, and we don't really see the person for themselves in that certain situation. So there have been many times where I've had so big of a patient load, and for me to be able to do the tasks very efficiently, I've had to basically cut my sentences short with the family. I've had to not explain everything to the patient about what's going on, what are we doing, and this is quite challenging for me because, I want to empower the patient and let the patient know what's going on with their life, why I'm providing these certain interventions, and it can be quite honestly very challenging to do that in a healthcare field where you're always short-staffed, and also there's just so much that you should be doing. And the reason I think emotional intelligence applies to this is because you have to be able to regulate your emotions, providing patients with morphine, with hydromorphone, or ketamine drip, or heparin drip, panto drip, all these different medications can be quite challenging for the patient to understand what exactly is going on with that person. And so being able to regulate that feeling and that you have for that patient, and to be able to control your emotions for a patient that's nearly passing. And once you practice quite a bit, you understand that this patient's condition is critical and things can go south really fast. And being able to regulate yourself and understand that, I have to try to do my best for the patient, but at the same time, I know that the patient's not gonna end up doing so great at the end of this, is quite difficult. And being able to work on yourself and build on your emotional intelligence so that you're able to regulate yourself in these stressful, high emotional states is very important as a registered nurse. And so a good way for someone to build on their emotional intelligence skills and to increase their emotional intelligence is by journaling. For myself, I have a wife, and I always talk to her about the different situations that occur at work. Having somebody that you can talk to and some place where you can write down all your feelings and emotions can be a great way of looking back and working on yourself, but also identifying what exactly happened during my 12-hour shift. I provided so many interventions. Did I do everything I can for that patient? Did I provide enough explanation? How can I do that better next time? And doing that has helped me build on my emotional intelligence and ultimately be able to regulate myself during difficult situations. However, I understand that not many people can actually regulate themselves, and journaling might not be a great way of alleviating all their emotional struggles. So I would definitely see whether your hospital has any therapy, any counseling that you can go to that can really help you with building on your emotional intelligence. Anyways, guys, I thought I would share this fact and talk about emotional intelligence because I do see how it's so relevant in a nurse's life, no matter which field you work in. If you like this video, please consider giving it a thumbs up. Please consider subscribing down below. As I mentioned, I'm going to be uploading a video every Wednesday and Sunday. And if you could share this video with 1 or 2 of your friends, that would be fantastic. I am a new YouTube channel and I'm trying to gain more audience for my videos. Thank you very much for watching, and I'll catch you guys in the next video.